Testing. Okay, we're going to invite people to come on down a little closer. Obviously, we have a small group, but we'd like people to come down, be a little bit more friendly and closer, easier to ask questions. And we'll get started in 1 minute. Thanks. Hey, Angel, can we do this without mics, or for the webcast, do you need the microphones? You need the microphones. Okay. Are you ready? Hello, everybody. I'm Nels Jensen. I'm the editor of the Press Enterprise. Thank you very much for joining us for this information session. We would like to welcome everybody to this session on the Affordable Care Act, this new, complex, and difficult to understand legislation also known as Obamacare. First, we'd like some thanks. We'd like to spread some thanks here to the League of Women Voters, who helped us distribute information about this event. We'd like to thank Riverside City College for their support with this facility and with the technical and audio as well. And we'd also like to thank the Center for Health Reporting, who along with the Press Enterprise is the host for this event. We're proud to play a role in ensuring that this would take place. We both believe that public discourse about this Affordable Care Act is very, very important. It's one of the most important health laws in our lifetime, obviously very controversial and confusing, so we'll try to sort through some of that tonight. A few words about our presenter, Emily Bazar. She is a senior writer at the Center for Health Reporting. She's written about health policy issues for about 4 years. She's been a news reporter at the Sacramento Bee and with USA Today. She's a native Californian and attended Stanford. Now, if you're a regular reader of the Press Enterprise, you recognize her from the Ask Emily column that appears every Monday. And her objective here today is neither to promote nor pillory Obamacare. Her role is trying to answers to questions about these new rules and regulations. She's going to give us, we'll open up the floor for questions. A couple ground rules. This is not a debate. It's not a referendum on the merits of Obamacare. This is not a political gathering. It's an information session. Emily is a civilian expert here helping us all try to navigate the system. She is not a government employee. She is not a promoter of the Affordable Care Act. Please be civil at all times. When we get to questions, we'd like people to come up and we'll give you the mic and allow you to ask the question. But we'd like to hold questions until Emily is done with her presentation. And also try to keep your questions short. We'd like to give as many people as possible a chance to ask questions. So we'll begin with the presentation. Emily?
Thank you. Can you all hear me okay? I'm sure you can. There's not that many people here, but thank you for coming. You guys are the diehards. I really appreciate it. So let me start quickly by telling you just a little bit about the Center for Health Reporting. As Nell said, I'm a professional journalist. The center is one of the nonprofit journalism groups that has popped up around the state and the nation recently as newspapers and other media outlets have cut their staffs. And so these kinds of centers are funded by nonprofit groups. And in our case, it's the California Healthcare School for Communication and Journalism. And what we do is we write about healthcare issues in California specifically. And we partner with different media outlets around the state, like the Press Enterprise. So we do have some literature in the back, or in the other front room, so please take a look at that if you'd like. There's also a sign-up sheet in the back if you guys want to get put on the Ask Emily email list. I send my columns out to people every 2 weeks when they run. So some of you are probably on that, I'm betting. Is anybody on it? Does anybody ask a question? No. Okay. Well, let me tell you a little bit about this Ask Emily column. It began in April. That was the first column. And at that time, we were thinking about how to cover this big law. This is the biggest change in the America's healthcare system since the 1960s with the start of Medicare. And we realized at that time that nobody really knew anything about this big, complex law. You ask people about it, and you just realize that there was an immense amount of confusion. We also didn't know how this column would be received. In the beginning, it was run, we have 30, how many, Richard? 40 media partners around the state. And originally, when this started running, we didn't know who would pick it up. It started out in 5 or 6 media outlets, newspapers, and now the 18th column just ran this week, and we're at 25 media outlets and newspapers and radio stations. There's an immense amount of confusion and curiosity about this law. I have received close to 1,000 comments and emails about from people, mostly in California, but also around the country and also around the world about Obamacare. So people are very, very confused. In the beginning, especially, do you guys know by now that Obamacare is the same thing as the Affordable Care Act, and it's the same thing as health reform? In the beginning, people didn't know that. I don't blame you, Another very common question I would get is, Emily, how do I sign up for an Obamacare form? There's really no such thing as an Obamacare form, and that's what I'm going to discuss today. This law is a mishmash of different programs. Some existing programs like Medi-Cal, which many of you may have heard of or may even use, and new programs like the new Covered California Health Insurance Exchange. And as Nell said, I'm not going to get into the politics of this law, but I do feel comfortable saying that it is a very complex law, it is a very confusing law, and I don't blame people for really not knowing what to do about it. So I'm hoping that I can clear up some of your confusions if you have them today. But let's start with, I want to take a little poll. How many of you have employer-based insurance or insurance from your work? So that's about half, right? How many of you buy insurance on the open market right now? Just a few, okay. And how about people who are Medi-Cal? Medi-Cal? No? And what about people who are uninsured? Okay, good. Okay, let's start. I'm going to start with I'm going to use this PowerPoint presentation as a guide. And as Nell said, let's hold the questions to the end because a lot of these questions, your questions, will be answered by this presentation. But if there is something on the screen or something I'm saying that you just don't get, please, you can go ahead and ask me. Okay, so why should I care about Obamacare? On January 1st, this law, like it or not, changes the rules of the insurance game for everybody in this room. Starting on January 1st, most Americans have to have a minimum level of health insurance. And we'll get into what a minimum level means a little bit later. If you don't, you're going to have to pay a tax penalty. And the tax penalty starts pretty low. Next year it starts at $95 per adult or 1% of your annual household income, whichever is greater. And then by 2016, it goes up to $695 per adult, or 2.5% of your annual household income. That can be a big number, actually. Children, the penalty for children, and yes, children would be penalized, or their parents would be penalized for not having them insured, is half of the adult rate. And the penalties that are assessed on your federal taxes. Now, this is a very important point. Oh, I forgot to ask about Medicare. Who's Medicare covered here? Nobody? A couple. Okay. If you already have insurance through your employer, from Medicare, or on Medi-Cal, if you're a veteran and you have some veterans help, or you belong to some veterans health programs like TRICARE or VA, you're covered. You don't have to do anything. That's a very important point. I've gotten a lot of questions from people who have Medicare and they're concerned about what else they have to buy. You don't have to buy anything, okay? There are some exceptions, though, to this requirement that you have health insurance. And who are they? Members of federally recognized Native American tribes, if you're incarcerated, which hasn't happened to you yet, if you're in the country illegally, you are exempt from the Obamacare requirement. And that's not necessarily, does anybody have questions about that aspect of things? That's not necessarily like a gift to people who are here illegally. The idea is the government says they shouldn't be spending federal money on people who are not here legally. Also, if you're a member of a religion that opposes accepting benefits from a health insurance plan, you don't have to have health insurance, but you can't just say, you know, I'm an anti-Obamacarian. You have to be recognized. This religion has to be recognized by the Social Security Administration. Also, if you are uninsured for less than 3 months of the year, you're okay. But you have to be insured then for at least 9 months of the year. Now, pay attention to this next one. If you can't find affordable coverage as defined by the law, you don't have to have insurance. And in this case, affordable is defined as your premium, affordable would be your premium being under 8% of annual household income. And I'm telling you to pay attention to that because there's, unfortunately, another definition of affordability in the law that will come into play a little bit later. If you don't have to file federal income taxes, you don't have to have health insurance. And there are also these things called hardship exemptions, and you would apply for them. If you were homeless for part of the year or recently filed bankruptcy, you can get out of having health insurance. So most people don't meet those exemptions. Most people in this room are probably going to have health insurance starting January 1st. Now what do you do? Remember I said that Obamacare changes the rules of the insurance game for you guys? It also changes the rules of the insurance game for health insurance companies. So have you guys heard of this? Right now, health insurance plans can deny you health coverage if you have a pre-existing medical condition. From if you've had a heart attack or cancer, or even I've heard of people who've had asthma or other things that you might not think are deniable. They have been denied. That stops on January 1st. People cannot be denied health insurance because of their medical history. And they can be charged more for that. Right now, they can be. There are things that health insurance companies can charge people more for. And that is families, of course, can be charged more than individuals because more people are getting covered. Older people can be charged up to 3 times more than younger people or the youngest people. And that may seem like a lot, but that is less than what happens now. Right now, older people can be charged up to 5 times or more than younger people. And then also, health insurance premiums are going to vary in California based on where you live. And California is such a large state, it's chopped into 19 different regions. And here in Riverside and also San Bernardino counties, you're region 17. And that doesn't, you don't really need to know that, what number your region is, but what that means is that the health plans you have access to are going to be different in each region. And they're going to cost something different because the prices are based on the medical costs in your region. So my hometown of Sacramento and also like the Bay Area is more expensive to get medical care there than in LA. So that's what they factor into the premiums. Health plans also have to cover 10 categories of services, and they're called essential health benefits. Have you guys heard about these in the last couple weeks coming up? They've come into play with these cancellations, and I'll tell you a little bit more about that when we get there. But these are the essential health benefits. And right now, plans don't have to cover all of these things, but starting January 1st, they have to cover emergency services, hospitalization, prescription drugs, mental health care, which is kind of a new thing, lab services, so these 10 things. And this is what is meant by having a minimum level of insurance. The insurance you have has to cover these things under Obamacare. You guys following me so far? Okay. So one option is Covered California. Have you all heard of Covered California in this room by now? No? Okay, good. So Covered California is the state's new health insurance exchange. And, you know, when I hear the word exchange, I think like the New York Stock Exchange, for instance. It's not really the same thing. This health insurance exchange is not one place. It is a new marketplace for health insurance plans in California. And Obamacare allows states to decide for themselves if they're going to run their own health insurance exchange or if they're going to go with the federal health insurance exchange. In California, can you guys hear me? Sorry, this thing keeps going. In California, we decided to run our own health insurance exchange, and it's called Covered California. And you guys may have been hearing quite a lot about trouble with the website, the health insurance website. California has had some problems, but they're not half as bad as the federal website, which is healthcare.gov. And the majority of states in the country use the healthcare.gov exchange. So, this exchange will offer 11 health plans across the state, but as I said earlier, not all are available in each region. Now, this is important, and we'll get to a slide next that will help you understand it better. All of the plans cover the same medical benefits. So, no matter what plan you cover, you're going to have those 10 essential health benefits in them. They won't have the different benefits, but they will cost different. The premiums will be different. There are the premiums are ranged based on these 4 tiers or levels of plans that will be offered to you. And the exchange has called them the bronze, silver, gold, and platinum plans. And the idea is basically that the bronze plan will be the cheapest plan for you in terms of your monthly premiums. You will pay the least for your premiums every month. However, you will pay the most for your out-of-pocket expenses with those cheaper monthly plans. The bronze plan, for instance, covers 60% of your medical expenses. On average, that's not very much, and we'll get to that later in just a second. Silver covers 70, gold covers 80, and platinum covers 90. But when you get to the platinum level, the monthly premium is much higher than the bronze level. Does that make sense to you guys? Okay. So let's look at this. This will make more sense, even more sense when we get to this next slide. So basically, you'll pay more each month for lower out-of-pocket costs, but there are limits. Okay, can you guys see this? If there's a pointer, but it's not very visible. So look at bronze. This is the one that is the cheapest per month and covers 60% of your costs. But take a look at this. If you want to see a specialist under the bronze plan, you would pay $70 out of pocket. The silver plan is $65, gold is $50, and platinum is $40. Same for primary care. I mean, right now for me, I have insurance through my employer. I pay $20. I have a good plan. I'm lucky. I pay $20 to see my primary care. But, you know, if you get the silver, it's $45. That's kind of a lot of money. Pay attention to this too. Under under the bronze plan, let's say you have to get an x-ray or go in for lab services, you would pay 30% of the cost of that. That can add up. Oh, well, just 1 second, I'll get you. That can add up. But there are out-of-pocket maximums. So when you hit these out-of-pocket maximums, that's when the insurance plan kicks in terms of paying 100% of the cost. Still, it's $6,400 for an individual and $12,700 for a family. I think that's a lot of money, but at least there's a maximum. Is your question about this?
Well, I'm actually a certified agent with Covered California.
Oh, okay.
The bronze is a $5,000 deductible, so nothing is covered.
Thank you.
Yeah.
Yeah, I was going to mention
And then
that.
$2,000 for silver.
That's very good. And they're right. $5,000 for bronze, $2,000 for silver. These deductibles are how much you have to pay out of your pocket before insurance kicks in. And then, but gold and platinum don't have deductibles. Moving on, you good? Okay, what can you buy on Covered California? You can buy plans for individuals, for families. There's a special section of the website for small businesses if they want to cover their employees. You can buy vision plans for children and dental for children. Now, whoops, what you can't buy in the no section, there are no Medicare plans sold on the exchange, no Medi-Cal, I mean, you wouldn't need to. You can sign up through Covered California, but you can't choose your plan basically through them. No veterans plans or large group like employer plans. And then dental and vision for adults aren't considered part of those essential health benefits. You might disagree with that, but they're not. And so they're not available on Covered California. Okay? Okay. So have you guys heard of these tax credits or the financial help that's available? For people who make a certain amount of money, and that would be between 138% and 400% of the federal poverty level, they'll be eligible for tax credits for plans purchased on Covered California. I know that doesn't mean very much, so 400% of the federal poverty level is about $46,000 for an individual. That's the top level. Or about $94,000 for a family of 4. But the less you make, the closer you are to that 138% of the federal poverty level, the higher, the more tax credits you're going to get, the more financial assistance and help you're going to get. And so the more you make, the less tax credits you're going to get. And these tax credits are basically, you don't have to pay the full cost every month and then get, reimbursed when you do your taxes. They're applied to your monthly premiums in advance. And keep in mind, you can only get these tax credits if you buy plans from Covered California. You can't get them for your employer-based plan or Medicare or anything like that. It's only Covered California plans. Okay, does anybody have questions about the tax credits, or not personal questions, but about understanding them? Okay, there's a second form of financial assistance that's available, and this financial assistance will help you pay for your out-of-pocket costs, and these are costs like when you pay your copay to your doctor, or your co-insurance, which is the 20% of the, the 30% of the x-ray fee or the lab fee, or your deductible. But not everybody who can get a tax credit can get cost sharing assistance. It's silly how kind of complicated this is. You can only get them if you fall between 139 and 250% of the federal poverty level. And you can only get them if you choose a silver plan. If you get those tax credits, you can apply them to any metal tier level, gold, silver, platinum, or bronze. But to get these cost sharing, you have to choose silver. Okay? And I'll show you here. So again, these are also on a sliding scale, like the tax credits. The less you make, the more help you're going to get. So if you make up to $17,000 as an individual, you would pay $3 to see your primary care. But if you make more, you would pay $40. That's still less than what you would pay if you didn't qualify for these, though. You also notice that the out-of-pocket maximums are less. You guys following so far? You good? You guys are good, actually. Do you want to try the calculator? Has Would it be helpful to do it? Did I do it? Yeah, okay. I'm gonna go up to my computer then. Does anybody want to be a guinea pig and provide, otherwise we'll just make up a scenario, but if you wanted to provide how many people are in your household and your income, you may not want to. Does anybody want to volunteer? Okay, we'll make it up. Oops.
How about 2 adults and $80,000 income?
Okay. Okay, so this is on the Covered California website, which is coveredca.com. Okay? And there are 2 adults, and the household income is 80.
Right.
And your zip, what would the zip code be?
92881.
92881. And that is Region 17. Oops. And what are the ages of the adults?
64 and 63.
Right at the edge of the Medicare, right? 64, 63. Okay. So then you click on, it's pretty simple, then you click on See My Options. Here are your options, and they describe first of all the metal tiers, but let's get rid of those. Okay. You guys will really see the difference with the bronze and silver and gold. Okay, here's bronze. Remember, these are the ones that are cheapest out of pocket per month. Wait a second, so 2 people, 80,000 don't get credits, tax credits, it looks like.
Yeah, I'm paying $560 now. Sorry.
Yeah.
Blue Cross.
So,
Doesn't help me.
yeah, so the income in this case was too high to qualify for tax credits. So you can see that even for the bronze plans, it ranges from $950 to $1,025 a month. Let's take a look, and that's bronze. That's a lot.
I double it.
So, but that's for both people. That's not for each. That's for the family plan. Okay, so silver. I mean, still a lot. Yeah. Silver ranges from 1158 to 1246. Let's see how high we can go. Gold, 1559.
I'm only paying $560.
I think you're doing better now. And that's the truth. That's the truth. That's what we'll talk about in a second. Some people are going to take a hit, and some people will do better under Obamacare.
It's going to cost more than my mortgage.
So, Health Net. Oh, okay, and this is, look, this platinum is $17.81 a month. That's a lot of dough. Yeah.
They give us my car.
Okay, so let's clear this though, and let's make up unless somebody else wants to try. You want to try?
Do.
If there's an adult child living at home still, that's gonna have to get it. What's the household income? Because I have my own work. He's gonna be 26 next year.
Okay, and I'll get to that in a second too. But if they're are they tax dependent? Then they don't have to get it. Do you want them to get it? Is that what you're saying?
Well, if they say how many people are in the household,
It would only.
it's kind of suck, right?
Yeah.
No, you claim them on your taxes now?
Add up the household
Okay, then
income.
he's a single person at age 25 with his
Well,
income.
He has 9 until 26, then he falls off.
Well,
But if he's still living at home, he doesn't have to be counted as. Does he have to be counted as part of the household?
thing is, she's offered company coverage, so he's not eligible for a subsidy.
Until he's 26.
Her kids are not eligible for a subsidy because she has covered insurance at work. So unless he goes off as a dependent on her taxes, he's not going to get a subsidy.
Well, I'm saying, when do I have to get this?
Oh, as soon as he
Boy,
turns
let's-
26,
we'll
the
take
month
this on
following
later.
turning 26.
27.
But so you should do it at 26, and what's his income?
Right now, he doesn't have a job, but
So he'll be on Medi-Cal.
Yeah, well, we'll get to that stuff. Let's do a little bit less. Let's say a family of, you want to do it? Okay.
okay,
There's one.
just her.
Okay. And then household income?
Say 19,600. 19,600.
Zip code?
92505.
Okay. And then the age?
63.
63. All right, what happened?
website, yeah.
Did I miss a step? Okay, so 63, okay, one person, 19,600 annual, 19,505.
Yeah, no, go, see your options.
Number
Right.
of,
Yeah, there.
Here we go. So, okay. Bronze 60. Why is it federal law? This plan has a substantially higher cost share with health care. Okay, there's bronze. Bronze is lower here. Okay, so your tax credit would be $471 if you chose the cheapest plan. And the premiums are $471, so somehow that still leaves you with $1 monthly premium.
But go to the next one down, and I think it'll be better. Because I think she could pay a little higher. Is that that's the bronze or the silver?
Oh, do you want to look at the cost sharing? Yeah, I'm just looking at all of them. So this is bronze. I don't know why silver is, and it's enhanced, so she will get cost sharing, is the tax credit is $524, which is surprising to me. Her total monthly payment would be $50 for a silver plan. See, in that case, that's good, right? I mean, and then if you want to look at gold and platinum, you would have monthly payments when you apply the credits of $125 through to $250. That's more, but still, it's okay. You guys should check that out if that's something that Do you have a question about this?
Do any of those carry a deductible that they have to meet before them?
Yes.
Okay.
Yeah, bronze is 5,000, silver is 2,000, and gold and platinum is 0.
Okay.
No deductible.
So bronze, they have to pay $5,000 out of pocket beforehand, before they have an appointment?
Before it kicks in.
Okay.
And then the out-of-pocket maximum is $6,400 for an individual.
except for wellness.
Right. I think you get 3 visits to your, and your preventive care is covered. Yeah, right. Per calendar year, yeah.
Yes.
I'm gonna walk and listen to you. I forgot to put my screen thing back up. Okay, I'm listening.
Okay, it's my husband and myself in the household.
Okay.
I'm the one, he's got Medicare, but I need health insurance.
Okay, I'm gonna answer that question. I can anticipate it probably, so let's wait till we get there.
Okay.
Okay? I think. You tell me if I'm wrong when we
I
get there.
bet you do.
You tell me if I'm wrong, so, okay, let's move on. Okay, so you guys know that open enrollment is happening right now for Covered California, and also for the open market. If you don't qualify for a tax credit, you can buy on Covered California, or you can buy on the open market. The same exact plans that are available on Covered California are available on the open market for the exact same price, but you can't get tax credits on the open market. You have to pay out full cost. This year and this year only, there's a 6-month open enrollment period. And it started October 1st, it ends March 31st. About 2 hours ago, I would have told you that you had until December 15th to sign up for coverage that begins on January 1st. But there's some kind of breaking news in California today. They extended that deadline. You have till December 23rd to sign up to enroll for coverage that begins on January 1st.
Do you know the other breaking news today
Yes.
on the way here?
Yeah, I'll get to that. Yeah. So you can, in Covered California, you can sign up online on that website I showed you. You can do it by phone, by mail. I've heard by phone and mail might be easier. There are some glitches still with the website. And then you're supposed to be able to go into tax prep offices or, CVS or Walgreens, but my editor who's sitting right here has actually gone and tried to find help at CVS and Walgreens and hasn't been able to find it. So, okay, this is where I might answer your question. Okay, first of all, if you're looking on Covered California, make sure that you check the doctor and hospital networks. There are cases, so for instance, Blue Anthem, for instance, is one of the insurers that offers plans on Covered California. And hey, you might have an Anthem plan right now on the open market, and you think, wow, I can get an Anthem plan and keep my doctor, right? Not necessarily. The plans on Covered California have different doctor and hospital networks than the plans that are currently available. They are actually limiting their networks so as to keep the costs down. So they're limiting the number of doctors and hospitals that participate. You're going to, when you sign up and they say, what is your annual household income? It's actually your estimated 2014 income. Be careful when you estimate that, because if you overestimate, if you say, let's say you make an estimation, that's what your tax credits are based on. And if you're wrong, if you made a lot more than you estimated, you're going to owe the government back money. You're going to have to pay it back. If you underestimated, it'll work in your favor. You'll get more credits. But just try to be careful. I know that's hard for people who are like contract workers or, don't have full-time jobs. And the income you use, I don't want to get too deep into this, but it's called modified adjusted gross income. So it's unfortunately, for most people, it's the same thing as adjusted gross income, which is the amount of income it's on your federal tax returns. For other people, for some people, it's not that. It is adjusted gross income plus tax-exempt interest, tax-exempt Social Security benefits, and tax-exempt foreign income. There are some other common sources of income that are not included, like child support or SSI benefits or veterans disability payments, things like that. It's complicated. I don't want to get too deep into it, but if you Google Ask Emily and Magi, there would be two very helpful fact sheets that I link to that will help you if you need more help with that. Or ask your tax professional. This came up in your question, I guess, kind of. So who counts as a dependent when, if you want to sign up for a family plan? Basically, again, it's a tax definition. Anyone you can claim as a tax dependent. So that's not only biological children, for instance, or your spouse. It could be parents that you're taking care of. It could be a child who is not a biological child. It could be a niece or nephew or something like that. It's a tax definition. So again, check with your tax professional. And may have been your question. Okay. Married couples, in order to be eligible for tax credits, have to file jointly, even if it's just one person in the couple who wants the coverage. That was your question?
Yes.
So I got a question from somebody who asked, I have Medicare, but my wife doesn't. That's the same thing. Even if it's just one of you, the household income is what it counts. Okay?
So Social Security income does
Taxable Social Security income, and to be honest with you, I really don't know what that means. I mean, in terms of,
So when you go into the Covered California, if you do have two people, let's say someone's 67 and someone's 61, you put that there are two people in the household, your income is $48,000, but you're only going to enroll one of them. You're not going to put both your ages. You're only going to put the person who's going on. So
but
the
the household income counts.
household income is for you and your spouse.
and you have to file jointly, otherwise you'd be ineligible for the credits.
But you have two in the household, even though both are not going to enroll. One's going to enroll the 63-year-old, and so when you go down to who's enrolling, you don't put the 63-year-old and the 67-year-old. You're basing it on just the one who's enrolling.
Okay, folks, moving on.
Because it seems like the premium would be outrageously high.
If just one person,
If you just put one person with all that income.
that's what happens. Is you're eligible for less tax credits because that's what happens. I'm going to my cheat sheet here, but if you need help, I actually have called this phone number, but I haven't asked a specific question. Some people have said they've been very helpful and others have not. But today, in other news, in addition to this delay that I told you about, they also announced that on starting Monday, California is going to have a hotline for people who have complicated situations. And and I would say that's probably just about everybody. So the hotline number, if you want to write it down, is 855-857, I don't know where the heck they're calling 855, but 855-857-0445. And I've not tried this myself. I've not tried this number, so that's what I saw in the press release.
What's that number one more time?
855-857-0445. Okay, this would be the point at which I would suggest a little break, but you guys seem like you're doing okay. Should we continue?
Please.
Okay. Okay, that was for people, remember the income range for tax credits is 138% of the federal poverty level to 400. Medi-Cal is the state's version of the federal Medicaid program. And Medi-Cal is for people who, Californians who are low income, also some people with some disabilities, but primarily for low income. And on January 1st, this is another big part of Obamacare that you don't hear a lot about. Medi-Cal is going to expand, and more than 1 million Californians are going to be newly eligible for the program. One way is it raises the threshold of the $15,800 for an individual and $32,500 for a family of 4. This is the big deal. The next one is that childless adults can qualify for the program. Right now they cannot. So if you're, 57 and don't have, minors, children, or if you're anybody who doesn't have kids, you can't get on the program. That changes January 1st. If you are eligible, I've had questions from people who are eligible for Medi-Cal but want to buy California. You can buy off covered California, but you won't be eligible for tax credits. Merely being eligible for Medi-Cal makes you ineligible for tax credits. So this is just a quick chart to show that the blue shows who's eligible now for Medi-Cal. And the green shows who will be newly eligible. So that's that raise in income I was telling you about to 138, and this is childless adults. So that's going to be a big population that joins the program. What if you are on the other end and you make more than 400% of the federal poverty level? You can, like I said earlier, you can still buy from covered California, but you won't get tax credits. That means you would be responsible for the full cost of the premium. You can also buy on the open market. Same price. Okay, this is what I think you were alluding to. Well, we have an answer today. It was funny. I asked my colleague who's helping me put this together, can you find a picture of Obama looking control? They buy on the open market. About 900,000 Californians have gotten cancellation notices, and some of them, if they
1 million now.
it's I hear both
1
numbers.
million.
All right, and some people looking for a new plan would, if they went on covered California, they qualify for tax credits. They get a better deal. Other people won't. The reason that people are getting cancellations is because a couple of reasons. Their plans didn't offer those essential health benefits that I talked about earlier. They didn't meet the Obamacare requirements, so they were having to upgrade their plans. So you guys remember that Obama said about a week or so ago, I can't remember,
Last
Thursday, that he was going to ask insurers to extend the plans through 2014, but really it's up to the states. And what happened today is in covered California, the board decided that no, in California you cannot extend those to 2014. So people who have received cancellations, did I ask already? You got a cancellation, or has anybody gotten a cancellation here?
Several of my clients have.
Okay.
I'm an insurance agent.
Oh, okay.
I have 200,000 insurance agents certified to sell just about anything, professional, licensed I've got E&O coverage of $1 million, I'm fingerprinted, I'm vetted, I take an ethics course every 2 years.
Okay,
One of those,
okay.
not a navigator.
You got a cancellation though. Did you want to keep your plan?
In my case, the company decided they weren't going to offer individual plans in California, period.
Aetna or something?
It was Aetna. They said that they were pulling out of the California market.
Yeah, right, couple and United, or no, not United, but.
No, United and Aetna.
And Aetna.
And then if you have an HMO with Blue Shield, that's getting canceled too.
Okay, okay, so you were gonna have to find something new anyway. So, yeah, basically, okay, we don't need to dwell on that, because there's not a lot of people here who had this situation, but California is upgrading all their plans. Okay, Medicare. As I said earlier, if you have Medicare, you're covered, you're fine. Don't let someone, talk you into buying another plan, you don't need to. Medicare doesn't change too much. The federal government says they're not changing the medical benefits of Medicare. One change is that people on Medicare won't have to, or don't have to now, have to pay for preventive services like mammograms and colonoscopies and other fun things like that. Do you guys know about the donut hole? People who are on Medicare? Okay, so the donut hole, this is a place, it's a mythical place. It's in the prescription drug program. People end up paying thousands of dollars for prescription drugs once they've spent a certain amount of money on the drugs. That's going to go away by 2020, so people will save money that way. But on the other hand, more Americans will be paying higher premiums for parts D and B of Medicare. I won't dwell on that too much because there's not too many people here with Medicare. Are there college students or young adults? A couple in here. Okay. Actually, I think you guys have some of the most options to choose from under Obamacare. One is something you alluded to. Insurance companies must allow parents to keep their children on their plans up to age 26, and a lot of people have done that, taken advantage of that so far. Other options. If you go to college, you can buy a plan through your college, but that can be very expensive. So shop around. This is a big deal, I think. College students can apply for Medi-Cal. I mean, some can now, but remember that whole childless adult thing? A lot of college students don't have children, and a lot of them don't work full time. So more college students may be qualifying for this program, which is free, basically. However, if your parents claim you as a tax dependent, their income will count towards yours, and that may disqualify you. You can buy a plan from Covered California, and you can qualify for tax credits if your income falls within those ranges. But again, if your parents can claim you as a tax dependent, you're ineligible for those credits, and you're ineligible if your parents can claim you, but they don't. So if you're merely eligible to be claimed as a tax dependent, you're ineligible for subsidies. So, which kind of sucks. And finally, there's a low-cost catastrophic plan that's available to people who are under 30 and can't find affordable health coverage. Okay. This is a question I got, one of the most popular questions I've gotten. How many of you have health plans from your jobs but don't like them for one reason or the other? Oh, everybody's happy with them. Maybe? You? No. Oh, you don't like it. Okay. So you can leave your employer's coverage and you can buy Uncovered California, but you may not, but in order to get those tax credits, you have to pass 2 tests. You have to follow with those income guidelines that I told you about originally. That's the first test. Then you have to prove that your employer's insurance is unaffordable. Remember I told you about that first definition of affordability was 8% of annual household income? Well, this is a different definition. You can show that your employer's insurance is unaffordable if the employer's share of the premium to cover him or herself only, and that's important, is more than 9.5% of annual household income, or if the insurance covers less than 60% of your medical costs. That's complicated, and I'm sorry, but those are the hoops you have to jump through to get the tax credits. I'm sighing because it's complicated. This thing called the kid glitch may make spouses and children of people with employer-based insurance ineligible for tax credits. And basically, this is a kind of glitch in the law. Remember I said if it's coverage for the employee alone that is less than 9.5 of annual household income, then insurance is considered unaffordable. Excuse me, affordable? Affordable, yeah. Then that means that the definition of affordability is met. It doesn't matter how much the spouse or children have to, pay or, the charge for the spouse or children for insurance. So basically, in a lot of cases, companies will offer affordable coverage to the employee, but when you want to add your wife or husband or child, they jack up the price a lot. So in that case, it would definitely be above 9.5% of annual household income, but they'd still be ineligible for tax credits. I mean, again, I know this is complicated, and I'm sorry, but for some people, this is important. Can we go on? Okay, we're almost done. Open enrollment. This is very important. As I said, in Covered California this year, open enrollment lasts from October 1st to March 31st. As I said, if you want your insurance to start January 1st, you have to sign up by December 20th. Yeah. Now, these are the same, but in future years, it's not going to be this long. It's going to be from October 15th to December 7th, which is the same open enrollment period as Medicare. From now on, this is also a big change. The open market will have an open enrollment period, and they're going to be the same as Covered California's. Right now, you can kind of sign up or change any time, is my understanding, but that changes. And remember, open enrollment is very important because you're not allowed to switch or buy insurance in the middle of the year unless you have what is known as a qualifying event. And that's one of these change of life events like having a baby or getting divorced or if a spouse dies. But otherwise, you're out of luck. So these dates are important. Medi-Cal, you can enroll anytime. And then your work-based insurance, it depends on your employer. Mine just ended, for instance, my open enrollment period. So one question I got.
You can't enroll anytime.
No, Medi-Cal, I'm sorry, Medi-Cal, you can enroll anytime, sorry. I got this question from multiple people. Well, if Obamacare doesn't discriminate against people who have pre-existing conditions or who are sick, then why can't I just wait till I have to go to the hospital to sign up for insurance or when I get into a car accident? Well, the reason you can't do that is because of open enrollment. Basically, like I said, you can only switch or buy plans in open enrollment or if you have a qualifying event. And having a car accident or a heart attack is not a qualifying event. So if you don't have the insurance in the middle of the year, you'll be responsible for the payments. Which happens now. Which happens now. But the question was from people like, well, with this whole pre-existing condition thing doesn't change. It doesn't.
But you could do that all the way until March.
This year.
Yeah, only once.
This year. This once. And
It's
yeah.
like a lot of late bloomers.
Yeah, exactly. So, and this is just information if you want to stay connected. And with my columns, I also don't always, I don't know how much people are into social media here, but I also tweet and post about other interesting things that are going on with the Affordable Care Act. So, and I have a new Facebook page, Ask Emily, if anybody's interested. And please sign up. Did I say already to sign up for the email list? That is it. And I'd be happy to take any questions. I may not be able to answer all of them because I'm still learning about the law myself. Every time I do a column, I learn about it. So, yes.
For example, how you said
us as college students, if my parents were to file me, I won't be able to qualify for an insurance for myself.
If your parents were to what?
They could claim me in their taxes.
You could still buy insurance on your own, but you wouldn't be able to get those tax credits on your own. But are you under 20? How old are you?
I'm 20.
They may be able to add you on their, are they already covered? Can they buy it? Through, are they planning on buying it through this, or?
Well, as long as we get the accurate information.
They can add you on their plan, is my understanding. So then you would all be, if you meet the income guidelines, you would all be eligible for tax credits.
Yeah, because I don't know how I may work with taxes, but as for what I'm aware of my job is that you can't be considered a dependent if you're over the age of 24, or if you're married, or if you're a baby, or if you're owned by the court.
You can be considered a dependent?
Dependent.
Yeah. I mean, so you are considered dependent is what you're saying?
No, I'm considered, I'm considered dependent.
I think they can, if they're signing up with Covered California, can add you to their plan. And then you would all be eligible for the credits if you meet the income guidelines.
And what about for people that are retired?
They can purchase on Covered California as well. Are they over 65? Because that's when you're eligible for Medicare.
Yeah.
They're over 65?
And what if they don't qualify for Medicare?
Is it because of immigration status?
No.
No, they would qualify. If they've worked here for at least 10 quarters, they're qualified. They should have Medicare already. But if have they worked here for at least 3 or 4 years?
Yeah.
Well, then they should have Medicare A already and probably have been offered B. And B is $104 per month.
Yeah, because they were rejected, so personally, I don't know about
Yeah. They would have to find out about that because also I think there's, and correct me, I'm still trying to figure this out. If you're eligible for Medicare, you can still buy on the exchange, but it depends, but you may not be eligible for those tax credits.
No, if you're eligible for Medicare, you can't buy in the exchange.
I think you can.
No, because you're 65.
Oh, right, because the plans go to 64, right, exactly, yeah.
But anyway, that lady in the front's an insurance agent there. What's your name?
Hi, Rita.
Rita and Mike, we're insurance agents. Are there any other insurance agents in here? So we know a lot about this stuff. So if you guys want, you can ask us. But we know a lot about the Medicare and all these individual questions. And first of all, I want to say, Emily, you do an awesome job. I'm always watching your stuff.
Thank you.
And I actually announced it this morning.
Does anybody else have any questions? Okay, a few, great, yes.
What is the poverty level amount?
Good question.
That's an excellent question.
We talked about the percentages, but you can figure it out. But
I'm gonna
I
just
am
go
not
up there since this is such a small.
52?
No, it's 11 something for an individual.
What was the question?
Poverty.
The question is, what is the poverty level? And since this is a smaller crowd, if it's okay with you, I'm just gonna go there and show you.
Then my other
It's
question-
actually 138 and it's 15,000, right
Oh,
about
that's right,
15,000.
138 is 15. Fine.
Yeah, right, and so that's why poverty, and you know, again, if you Google, I sound like I'm just plugging myself, but if you Google Ask Emily and federal poverty level, I link to them so you can get the link. So, federal poverty level guidelines, and you can see that I've gone to it many times. Okay. So,
Yeah, there it is, right there.
It is.
for one person, it's 11,490. This is this year. They change every year.
Yes.
So this is 100% right here. The 138, you'll be at about 14 or 15,000.
And, okay, so you can see, yeah, for 2, 3, 4, 5 people, it changes. Okay? Does that answer your question?
Right, it does. Thank you.
Okay.
And my other question is, the case that was cited, approximately 19,000 for the individual.
Hawaii.
Oh, let me come down. I can't hear you. Okay, sorry.
The case that was cited that you put up on the board, the 19,000 for the lady, why would she not go to Medi-Cal? I thought she was under 65.
Because it was, the limit is 15,800 for an individual for Medi-Cal. That's 138% of the federal poverty level. She was above that. But she still would
Get a
get
good deal on it.
great credits because she's not so much above.
So she's the person that in that category is getting the absolute best deal.
Yeah.
Because she can buy for 50, $100 the best plan. But if she made under 15,000, she only can go on Medi-Cal. So her situation is
Well,
the
she could buy
absolute
for
best
base pay,
situation
but
to
she
be
wouldn't
in.
get tax credits, which would make it probably unaffordable. So, did you have a question?
Yeah, my question is regarding the income, the modified adjusted gross income.
Yeah.
So if, I don't know if you know this or not, but if you have an IRA and you want to transfer money from that IRA to a Roth IRA, you end up having to pay taxes on it.
Okay.
And it shows up as if it's income because it's taxed as regular income. Is that the sort of income that also goes against your annual? Does it turn into
The only thing I can do for you is read you what's in these nice cheat sheets, and I think you should go and look online. But it says MAGI, modified adjusted gross income includes blah, 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 but you deduct an IRA deduction, but that's not a deduction. So I would say I can't answer that for you.
Okay.
We really need to check with the tax person. I'm sorry. And by the way, if you are interested in this, unfortunately, it's modified adjusted gross income, I wouldn't just Google MAGI, because there are different definitions of MAGI for different things. So Obamacare has its own definition of MAGI, unfortunately. Okay?
Is that line 23 under tax?
I think it changes every year.
Does it change?
I think so, or it changes because I would see different numbers for AGI. It's your adjusted gross income plus or minus these other things. And you guys can take a peek at these forms, but as I said, if you Google MAGI and ask Emily, you can link it to them. Yeah.
The 10 guide criteria for
10 essential health benefits.
I see why some people have to go up, but because if you're a man, why do you need maternity leave?
Well, I mean, I know,
You're
but
63 with a tubal ligation, why do you need maternity coverage?
well, and why do I need prostate? Why do I need to pay for prostate tests?
Yeah.
I mean, but that's the point of insurance, that everybody kind of pays in and the pool is broad.
I can see that's why some people are.
Oh yeah, I've gotten emails from guys who have said exactly that thing. Why do I need mammogram?
I don't need pediatrics.
Yeah, exactly. But I mean, I think that the whole, yeah.
So it's a one
I can't
size
answer.
fits all. One size fits all.
Yeah, I
Everybody buys the same car.
You're
It's a
making
pool of
it's a
preventive.
pool. Yeah, I mean, you're sharing the risk, I guess. Just like auto insurance, right? You're not going to have an accident every year.
Yeah, I work for state disability insurance, so.
Oh, so you know. Yeah.
People
Yeah.
say, that's, I guess.
Auto insurance is different.
They're really-
You can put up a bond.
Okay. I'm good for that. Ben, anybody else?
Would you happen to know if, hold on.
No, go ahead. Go ahead.
Would you happen to know if the W-2 forms for this year, that's the
2013.
income for this year that are coming out in January have to have the health care costs on them? Or is that for 2015?
The 2014 is going to be done in 2015. Your 2014 taxes are going to be done in April 2015.
Nobody signed up yet.
Nels, did you have actually a question?
Yeah, we got a number of questions from readers, and I
Oh,
just
yeah.
wanted to share a couple of them. One of them is a married 55-year-old spouse has insurance through work. Adding the spouse is very expensive. The question is, as that individual seeking care through Covered California, is the spouse's income going to be counted in that? Right.
Yes.
But that person's not eligible because that person was offered coverage through his work. So she is not, or he is not eligible for a subsidy because the married couple was offered coverage, they declined it, that person's not
Right, not
eligible
the-
for the subsidy.
That's right.
Right, not the
You-
subsidy, right,
But the income doesn't matter then.
Right,
Because,
right.
yeah.
okay.
do you have-
So it's just open market rate versus the additional cost, okay. And the most common question we got was, what is the actual enforcement? I'm not gonna, the first year the penalty's minimal, I'm just not gonna do it.
That's a really good question, and as far as I know, it is self-reported. So I don't know quite how the government will or could check on that. I mean, they possibly could, but I mean, how are they going to know that I'm getting insurance through my employer and you're getting it through Covered California and you're getting it through Medi-Cal? I mean, they're going to know some of that, but I think they're going to go on the honor system. You're going to have to check a box saying I did not have insurance in 2014.
Tax return.
It is going to be part of the tax. It's going to be part of the tax
And
return.
the employer is going to be responsible for reporting whatever.
That's true, actually, that's
So
true.
they will be.
I don't know how much they will be checking, though, to be honest. I don't know, we'll find out.
So it'll be more like a tax code violation than any legal?
No, if you put on, I think they're gonna eventually say, who is your insured, what's your ID number and all this. But I think if you say I didn't have insurance, and then I did have insurance and you didn't, then you're really basically, it's almost like fraud. So it's a pretty serious question that I did have insurance when I really didn't.
Yeah.
So it's not a simple question to say, I had it when I didn't.
And they put a penalty on top of the tax?
So that's gonna be a problem for people who lie.
Well, yeah, I mean, it would be lying on your income taxes, right?
So
So
not only that, they're all going to be interlinked. So that, you know, the IRS, the states, everything's going to be interlinked. And there's going to be more reporting on the employer's side, and we don't even know it.
well, that is true, that's a good point, and so a lot of our personal information is gonna be flying around, even more than it already is, so, yeah.
Question on the Covered California, how do they collect their premiums?
Yeah.
What if somebody in the middle of the year loses their job and all of a sudden they don't have the money to pay in to get their next month's?
They pay to the insurer.
To the plan.
Is that what you're asking?
California is not a
Yeah.
insurance plan.
Yeah, they
I
pay,
understand that part, I understand that part,
For the credit card.
but how,
Prepaid credit card.
I wouldn't let that happen. What does that do to your yearly total of months covered?
if you have to get out.
Yeah.
They might be eligible for Medi-Cal in that case, you know, or,
That's a life event.
and that is, yeah, I mean, it changes, yeah, but then the question becomes, what would they become eligible for, and could they afford it if they're not eligible for Medi-Cal?
That just used to be so simple.
Yeah. Yeah, I mean, yeah, yes.
There's been a lot of talk about the justification for having the Affordable Care Act was that if everybody's covered, then there will be less likelihood that somebody's going to wander into the emergency room saying, I just broke my arm, fix it for me, no, I can't pay. Has there been any talk about that side of things, about an increased likelihood that the hospital will say, no, you have to have insurance now? Go
If there's
away?
an emergency situation, they cannot.
Yeah,
by
I think
federal
that
law.
works.
So that hasn't changed.
Yeah, that has not changed. Yeah,
Millions of people who use.
Doctors can refuse extra new patients.
that's
The
federal.
hospitals can refuse extra new patients.
Right. Or not, or yeah, my mom's a nurse, she's sitting right here, and she, you know, she's right that, that has been the law for many years and that does not change, and, you know, there will remain uninsured people after this goes into effect. As I said earlier, that people who are in the country illegally, for instance, there'll be others, but people who are in the country illegally are not allowed to purchase on the exchange or get tax credits or join Medi-Cal other than emergency Medi-Cal. And that, the projections are that there will still be 3 or some million Californians without insurance. So, and that's not going to change that when they seek care, they're gonna, if it's emergency care, they're going to get it.
And the other point is that there are over 1 million Californians who are eligible right now for Medi-Cal who aren't signed up.
Right.
And they don't expect that number to change enough.
Right.
So they'll be going to ER.
Right, and even the people who are newly eligible, right, not everybody's going to sign up. So,
But wait till it's fixed.
yes.
You said there would be like limited doctors in the network. What about creating a kind of program?
Yeah. She asked, you know, you said that there would be limited doctors in the network. Would that create an impacted program, meaning that doctors, you might have to wait to see your doctor? Yes? It could. We'll see, but I mean, yes, that's a concern that people who have insurance now also might have to wait longer as more people will go see their doctors, you know, now that they've got insurance. So, yeah. Yes.
So I think two things is the people that are not enrolling on Medi-Cal now, they do not want to be in the system. They don't want to be counted. It's almost like they don't want to be in the immigration or any of that. They don't want to be counted. And so then the second thing is on this gentleman's thing is that I don't have coverage and I go in and I get emergency care, let's say I have a heart attack or something, they're going to treat me. But let's say I have a twisted knee and it's pretty bad, but I can hobble around. The doctors, I think the result of this is the doctors in the clinics are going to say, I'm sorry, Mr. Ream, you had the opportunity to buy insurance. If you need services, we're going to charge you right up front, and we want to get payment. We're not going to let you go through the system because we have a new law and it said you had to buy insurance, and so now you're going to want to stick it on us, and we're going to have to try to bill you. I think the clinics and the doctors are going to be less lenient because they're going to say, you know, you're not playing by the rules.
And
That's what I think is going to
that
happen.
may be, I just don't know. There's still going to be a safety net, you know, clinics, there's still going to be clinics that serve people no matter what their problem is, their medical problem is.
Yeah, what's classified as an emergency, you
Yeah.
can't refuse.
Yeah.
Oh, yeah.
Yes, sir.
Yeah, where does one get an application to get?
Yeah, it's a really good question. If you do it by mail, where the heck do you get an application?
I have applications and you can download.
I was going to say, you can download it off Cover California. I mean, you can do it online, you can download it, and I'm not advocating for this, but so you know, as these agents have told you, Cover California is certifying some insurance agents, and there's a link that you can go to, and also they are calling them navigators or counselors who can help you, walk you through the process. So you should find a certified agent or a certified counselor, not should. One option is you could find a certified agent or certified counselor who has gone through the training, and they can help you sign up, and you don't have, they do get paid, but they get paid by the insurance plan or Cover California. You don't pay for that. So, but if you do that, try to go see somebody who has a lot of experience already in the insurance market, and who, you know, if it's an agent, for instance.
On the main Cover California site, you go and you have to start, you know, it says start here, and then almost immediately after that, it'll say find help near you. You click on that, and then you can type in a person's name or a zip code and all that, and then all these people will pop up. And then you can look and say, oh, this guy's close to me, I know that person, or you know, and then you click on that, and then you can contact that person.
If you don't want to go online,
See?
you can also call that number that was up on the
Yeah.
screen and ask them for where you live, and they can look at it.
I'd just like to offer a point, and that is, since we're talking about the website and whatnot, there's some people that may not be all that familiar with the website
Right.
or computers in general.
Right.
There is a bogus site, an improper site called
Yeah.
Covered California. It's not the site to go to, it's Covered CA. is the correct site.
CoveredCA.com. Make sure you go to CoveredCA.com. Yeah, there's going to be a lot of more fraud than there is.
And by the way, if any of you go to any of the major drugstore sites, CVS or Rite Aid or Walgreens, they have clicks on their site that get you into information about Obamacare, about the Affordable Care Act. But beware, because they will send you to healthcare.gov. They will send you to the national site, not to the California site. The
Yeah.
national site does no good for you at all.
That's an excellent point. You cannot purchase as a Californian health insurance from healthcare.gov.
Right.
You have to do it through Covered California.
Is it .com or .gov?
Healthcare.gov and coveredca.com. Yeah.
And just so you know, every weekend, they're almost closing the site, the Cover California. So if you want to find out information and get more information, you're only able to Friday at like 6 o'clock at night until Monday at like 6 in the morning. They close it. So if you start an application, you can't finish it. So if you want to look at the stuff, you'll be able to look at it for the very cursory stuff, get stuff, but you're not going to be able to start an application. And so it's kind of like,
Yeah, they've been taking it down to upgrade it and
it's just
add
crazy.
the small business exchange and all that sort of thing. Hopefully it won't be for every weekend. So, yeah.
Okay, the national website has been said to be a hacker's dream and an identity theft dream. Okay, that being said, okay, and they're saying that even now, any number of things can be stolen. Basically, all the information is all there on everybody. okay? And navigators can be felons, and it's scary, really scary. What about California? Is that safe? Am I going to take my clients there?
That hasn't even been addressed.
I think it's more safe than Facebook.
Yeah, I think.
I don't know.
You know, I mean, that's hard for me to answer because I'm not an expert on that sort of thing, but I have to admit that I am a little bit of a kind of privacy paranoid person. I don't like all the information, you know, given out there, but that's the way it's going, and it is. I can't speak to the security of the site, I'm sorry. They say it's secure. They say it's secure.
I mean, you can print the application and fax it in if you don't want to have it go over the internet.
Yeah, you know, that was
That's what
something,
I mean.
that was a very good point. You can print it and mail it in.
Or you can
and
print it
mail
and fax it in.
Yeah.
Do it by phone?
Yes, now.
Several readers asked about varying income. Just the nature of employment these days, income varies a lot from person to person and household to household. How is that going to work from year to year? Is this going to be an annual application
Yes,
process?
it's going to be an annual application process, and the rates may change in 2015, you know, depending on what happens. So, just a second. Again, if in the middle of the year your income changes a lot based on what you estimated, you should call Covered California and get your tax credits adjusted and your payments adjusted. Because otherwise you're going to be in for possibly a rude awakening at tax time.
People also want to know that it impacts their HSA, their health spending.
Roger, do you want to take this question? This is a bit of a hole in my Obamacare knowledge. Actually, I've gotten a lot of questions about health savings accounts. There is one option via Covered California for bronze health savings account, but that is something I'm going to address in a future column, so keep your eye on my columns. Sorry. Yes.
Question, when you sign up now, and when you turn of age for Medicare, and you're under this Obama, and you go with Medicare, but you can elect to get a supplemental, are you going to get fined for dropping Obamacare?
No, that's a special, that would trigger a special, I mean, that's a change qualifying event. You would qualify for Medicare. So no, it should not be a problem. It's not supposed to be a problem.
No, and Medicare is a qualified plan.
Yeah, and it's, right, exactly. It qualifies, as we said, for Obamacare. So, but what you're asking is if it happens in the middle of the year and you switch, yes, you will be allowed to switch. So, yes. Okay, folks, I think that's it, right? Unless anybody has anything else. Thank you guys for coming out.
I have one last question.
Yes.
Sorry. I talked to Anthem Blue Cross enrollment people, okay? My insurance agent, I talked to them frequently.
Yes.
They said that they could not guarantee for 6 months and you rate in 2014. They could not guarantee for 1 month what the rates are going to be in 2014.
Next year?
For an individual